Fractures of the paws are best handled with splints. Ideally, if there's at least one metacarpal or metatarsal bone that is intact, that makes life a lot easier because you're already working with a bit of an internal splint, which kind of helps hold everything together. Don't worry that they're not totally properly aligned. The body will take care of that with time. Even with all four metacarpal or metatarsals fractured, you can simply splint that paw until it's healed. The problem with metacarpals and metatarsals is that they're slow healing bones. They do not have a huge, fabulous blood supply like the femur and the humerus that's surrounded with muscles. They're only surrounded by tiny little muscles and tendons, if that, and therefore they are slow healing bones. If you are dealing with an adult dog, you splint the fractured paws, you can expect that it's going to take a minimum of 8 weeks, often up to 12 weeks. So prepare your client, prepare your staff, because these are going to take quite a while before they heal, which means bandage changes, splint changes on a regular basis. And honestly, they're a pain, but they will heal fine without surgery. The thing with surgery with these fractures is that the healing itself still will take a long time, and often because we're just dealing with a small pin that we'll place in the metacarpals or metatarsals, they often still do need to be splinted. Also, pinning such a small bone that has a poor blood supply is already causing more disruption to the blood supply. So surgical repair of metacarpal and metatarsal fractures is also fraught with a lot of complications. With paw fractures, metacarpal, metatarsals, in a mature animal, it's just going to be a long journey. Clearly, if it's a puppy or kitten, they'll heal relatively quickly. If you are dealing with the phalangeal fractures, a phalangeal fracture, again, splinting is the best way to go, at least until the pain is disseminated, is kind of reduced. And then some people just leave them without anything, because splinting paws and managing splints and bandages long-term on paws of dogs and cats can be frustrating for everybody involved. Sometimes if it's the distal phalanx, amputating the digit might be the fractured digit might be the quickest way to deal with it, especially if it's the second or the fifth digit. Something to consider. But your best bet with paws, splint them. Don't get too excited if you don't see callus formation after 8 weeks. It's going to take a while.